Morning, everybody. I'm delighted to be here this morning and delighted to talk through our new climate change adaptation plan for the health sector. And thanks for inviting us along. As was just mentioned, I'm from our department's policy and strategy division. I'm not a climate change expert, just to begin with. I'm probably amongst the least expert people on climate change in this room, I'd suspect. So how did I end up speaking on the stage? I do have some expertise. I worked previously in the Department of the Environment, and when I was in Foreign Affairs, I was on the team that co-facilitated the negotiations of the SDGs in 2014, 2015. So I have some experience in the area. But basically, our Secretary General announced, we have to have a plan done, draw a team together, and give them a hand in getting it done. And that was done basically from the start of the summer to the end of the summer in recent months, and I'm glad some of the team members actually from the department and from the HSC are here this morning, and I'll be happy that they'll be fielding all the difficult questions you want to pose afterwards. Our plan actually landed with a bit of colour. It was a cold and wet lunchtime in early November, and outside Leinster House there was bikinis, Bermudas, sun loungers, beach balls, snorkels, flippers, a bodyboard, a sun parasol and a large sign saying Leo's Fantasy Island, as Extinction Rebellion protesters protested the Taoiseach's comments at the launch of the various different adaptation plans. We feel a small bit responsible because there was 2 lines in our plan talking about some health benefits to climate change, around physical activity, maybe fewer deaths from the cold. I think there was 49 words out of about over 18,000 words in the plan dealing with the upsides, and all the rest of the plan is about downsides. Well, really, the plan is really about the upsides of taking action, actually. Adaptation action specifically in the health sector, and downsides of not taking action. So we'll get into it. Some key points maybe of reflection just to begin with that we can keep with us as we go through some of the slides. I hope it's not too dry. It'll be sort of some policy making points as we go through, so I hope it's not too procedural and too dry. But some main key points of reflection. The context here is you have an overwhelming agenda in the health sector, as you're all aware from reading the newspapers and media, and you're using the health services. So we have a health sector running at absolute max, okay? This is another issue, a strategic issue, a complicated issue, a cross-cutting issue. And there's a real challenge of how we place climate change and the health impact of climate change up the agenda, onto the agenda in a really firm way and give it the prioritization it deserves. Climate change is a multiplier, and very unfortunately, the health impacts of climate change are going to be most felt by those already most vulnerable. This is a key point that the Minister was making when he launched it, and we're talking about the elderly. These people were mentioned earlier as well by Patrick in his presentation. The elderly, children, people with chronic conditions already, urban poor farmers and others, okay? So there's a question around leadership in the sector, from the department, from the HSC, from other agencies, from all actors involved, I think, in the health space. It's a challenge getting health in all policies, as was already mentioned. This isn't an easy issue, an easy approach. If it was, we'd already be doing it more successfully. But many health effects obviously originate in other sectors, in activities in other sectors, in policies in other sectors, or maybe the absence of policies in other sectors. So it's a cross-government challenge. Fortunately, health effects are a really good way to engage people about climate change, the health impact on people, the health impact on your family close to you. Very good opportunity to communicate very effectively with people about the importance of climate change and about the importance of behavioural change by society. And the plan, just more generally, was a great opportunity, I think, to highlight existing work that's been done in the area, to bring it together in a coherent whole and a platform to build on it as we go forward. And as I say, to bring more attention, generate more attention about the issue. Here's just a definition. We've heard some of this before. There's exploiting the beneficial opportunities that we mentioned that sort of got caught up with the launch. Why now? The Lancet defines climate change as the biggest global health threat of the 21st century. More immediately, we had a statutory deadline to produce a plan by the end of September. Briefly, we'll talk about the framework, but I think John has covered that very well, so we'll just skip through it, talk more about the health sector plan and what we wanted to focus on and how we ended up focusing on priorities, key areas that we need to look at in terms of adaptation and taking things forward with next steps. There's a very strong framework and strong support and leadership from John's department. He asked me to say that earlier. We've got a framework here in terms of legislation. The adaptation framework was mentioned, the guidelines, very useful and very comprehensive guidelines that we followed very carefully, and obviously the action plan that was launched recently. So we're in a context here of other plans and other sectors going on. As you can see, this is the department and the HSC role in terms of public health. The vision is reduce climate vulnerability across the health sector. What does that mean? What does climate sector vulnerability, like what does that mean in English? It sounds like jargon, you know. What it means is we're talking about population health and well-being, really, you know, and we're talking about preventing where we can avoidable illness. We're talking about strengthening health services and social care services and also our infrastructure in the health sector to severe weather and to other negative effects of climate change. It applies to the department, HSC and other agencies, organisations providing services for HSC and basically everybody in the sector, GPs, primary care, private hospitals, private nursing home, etc., and other social care providers. A team was established, a cross-functional team, and here you're getting into, it's sort of affecting a lot of people in different organisations. It's one of the difficulties. So there's a real difficulty in like who is the actual clear lead here, because it's a strategic issue, but it's a very cross-cutting issue. And you have people from quite a few different functions and different divisions, within this case, the HSC and the department involved. And I just want to pay tribute and acknowledge some of my colleagues on the team, the joint team that produced the plan are here today. So I just want to pay tribute to their work. A lot of this work was done, you know, we had to do it quite quickly in the end, out of hours, in the evenings, weekends, and people putting their hands up to produce what is, I think, a fine plan. And before I forget it, in case I do, there are hard copies out where you got your coffee earlier. There's a few copies left, and it's also obviously available on our website. Okay, we follow the steps. I don't want to get into this too much, but there's clear steps that were given under the guidelines, which I said from the Department of Communications and Climate Action, which we were obviously very careful to follow. Two real principles here. We were trying to be as collaborative and inclusive as we could in how we did things and try to engage stakeholders and bring in the expertise into the policy-making process and the decision-making process. We had an experienced team, the people who actually joined the project team to produce it. We had a public consultation where we got some good input and obviously input from other government sectors. And we mentioned earlier the effects originating, health effects originating from other sectors is important. We also tried to be very evidence-based to the extent we could. So there was 2 literature reviews. They're available on the website along with the plan. We looked at international best practice elsewhere, people who are further ahead down the road, a little bit further down the road than we are in Ireland in terms of health sector and climate change. Concrete learning from past events, you know, emergency management and emergency response. And we had workshops looking at risk assessment, and I'll come to that in a moment. We did come up against the limits of data. And data and research is a massive theme that's emerging and will emerge in terms of health effects in Ireland from climate change, and I'll come back to that again. What are we adapting to? I won't spend too long here because this was covered very well. There's Met-Éireann and Irish Centre for High-End Computing, modelling and simulations, and basically what we're looking at is a future, projections, climate change future. So our climate's going to be less dependable and less stable, a more frequent and more intense weather events, increases in average temperature, 1.5 degrees by mid-century, more so in summer days, even more again in winter nights. You're looking at wetter winters, particularly in the west of Ireland, and you're looking at drier summers, especially in the southeast, and you're looking at sea level rises across the board. What does that mean for healthcare and people's health? Well, we're trying to focus in on what the real health impacts from those projected climate changes, and climate change that's already underway, of course, importantly. So some of the major health effects on human health and for our health and social care services and our infrastructure, sort of setting priorities on this, like where do we begin almost, you know? It's like a funneling exercise, and I mentioned the literature reviews and looking at the literature and looking at the scientific evidence and looking at others ahead of us, what had they looked at, but bringing it down into an Irish context was extremely important. We identified 3 main themes really in terms of risk and vulnerability in the health sector. I mentioned these earlier. This is the people, health and well-being of people, and the health services, business continuity, dealing with severe events, and also infrastructure resilience. And you funnel down through further. So we identified those three themes, and there was a stakeholder consultation at the very start of the process because we wanted to get stakeholders involved early to benefit from their expertise very early in the policy-making process. And stakeholders were asked to focus on these themes primarily. And as a result of the stakeholder consultation, we then did some risk assessment around the likelihood of some of these health impacts that were floating around in our minds, the likelihood they'd be happening particularly in the coming years, and then trying to assess the magnitude of the health impact from these, using those three main lenses I mentioned on the previous slide. Again, contextualizing it, particular health vulnerabilities in Ireland related to our geography, environmental influences on health, our health behaviour. And we sort of landed, after this risk assessment process, on 6 priority areas of concern, really, priority climate stimuli and scenarios. They won't be a surprise to you here from listening this morning, because there's already been focus on these. But I think just personally, before I would have begun the process, I wouldn't have been surprised to see severe weather up here. I'm not sure about the rest of the team, but you were kind of surprised at, I think there's a slight bit more invisibility. There's less visibility around some of the effects, the health effects to do with these. I'm not sure that there's widespread understanding of just how significant slow onset climate-mediated effects are, or entirely what they will be in future years ahead. These are very big issues. So there's 2 points here. There's 1 point, the availability of data. So there was hard data, there was quantitative data, and we've heard figures dealing with air pollution and premature deaths from air pollution, and over 1,000 premature deaths in Ireland each year. And this is going to be worse by weather-driven effects of climate change on PM, on ozone, on air allergens. Also UV radiation. Irish people particularly susceptible with fair skin. And I'll come back to this in a moment. But what I'm trying to say is that we have data limits, and already our data is informing our priorities. Is this a true picture? Are there things that we've missed? Are there things that should be reprioritized? Well, that would depend on the data that you have. And these 2 issues definitely got driven up the agenda because we had more data available on these issues. It's already affecting our approach and our thinking about climate change. There is a big data and research gap that we need to start addressing. The second thing is that these priorities that we identified were then put out to public consultation, and there was views sought. So we used stakeholders to look at some of the 3 major themes and vulnerabilities we felt, and we then used the public and other stakeholders to look at some of the priorities we had identified as the process went on. It was a very iterative process that we tried to pursue. This is an infographic, you can't read terribly clearly maybe here, to do with environmental risks, environmental effects, health impacts and recommended action. This is Dr. Ina Kelly was involved in developing this. This is maybe a clearer read, showing the linkages basically between climate, environment effects and then health impacts. And this doesn't have the column dealing with actions, obviously. So what does all that mean in terms of adaptation, our response to these, potentially profoundly impactful climate stimuli and events and scenarios? There was there's sort of buckets of action really that we place things in. There's a natural grouping of actions around severe weather. On the slower onset, climate-mediated effects sort of have their own boxes. There's a piece around monitoring, research and evaluation. There's a very important piece around leadership and oversight and driving this agenda. I think it's fair to say we need a more structured, we need a more dynamic, and we need a more inclusive and collaborative approach to climate change and health in the health sector. The development of this plan, the statutory obligation has been a tremendous opportunity, and I think bouncing forward and implementing it is a tremendous opportunity to drive it up the agenda. It's almost like a wake-up call. There is a lot of work being done, but we need to do an awful lot more. There'll be a new climate change oversight group that will be appointed, led by the department, but will be inclusive and will be very collaborative in its approach, chaired at senior level. It's not called, you'll notice, an adaptation group. It's called Climate Change Group. So this was just an adaptation plan, but we need really to be talking a little bit more as well about mitigation and what's going on. There is stuff going on. We need to broaden, to have the remit of the group broad enough that it's not just adaptation activities we're talking about. I think the leadership and the governance needs to be collaborative, as I mentioned, and include stakeholders and include them early, like we try to do in making the policy. And I mentioned research and data and addressing that several times. Okay, practical things, we've already heard about them. I think it was Patrick was mentioning the blind spot in terms of we need to do a bit more work on the heat end of things, and heat wave and response and behaviour change, and how strong we are in terms of severe weather. Infrastructure resilience, a survey of it, mainstreaming weather planning into business continuity planning, sharing lessons learned. Some are conducted, but not necessarily maybe shared as widely as they could be in terms of severe weather events that do happen, and learning. And it's an iterative process, learning and responding better the next time, adapting better the next time. I mentioned about climate change resulting in increased exposure to UV radiation, higher levels of ambient UV radiation, and more people spending longer out in the warmer weather outdoors, and Irish people's particular susceptibility to skin cancer. And the figures were mentioned in terms of skin cancer before, over 1,000 melanoma diagnoses every year, and that's set to double by 2045. That's not including the impact of climate change. Okay, so we need data, more data, I think, in this area, and maybe attributability as well to build the case around health impacts of climate change. There's a very good skin cancer prevention program was produced earlier in the year. It needs to be implemented fully, and an increase in awareness and preventative action, targeting higher risk groups is very important as a practical action. Air pollution, again, we mentioned the deaths, over 1,000 people dying prematurely in Ireland from air pollution. It's pretty stark deaths, So you're looking to decarbonise, but you're also looking to adapt. And again, air pollution affecting the most people who are most affected, most vulnerable people. That's where the effects are falling. And climate change will bring an increase in air pollutants and ozone, as I mentioned, PM, air allergens. And again, we're looking at research agenda here. We're looking at public education, particularly targeting the higher risk groups. We're looking at health and all policies, addressing sectors where some of these health effects are originating, and then obviously robust monitoring and continued focus on research and evaluating as we go. Okay, it's a live document, this plan, and the group meeting will be able to reassess as they go and add in actions and tweak things and change things. So just to conclude, in terms of next steps, there's a whole lot you could say. I mentioned the need for leadership and governance in the sector as a whole. The oversight group will be established, hopefully before the end of the year, taking a structured and a dynamic and a collaborative approach, so bringing in stakeholders who feature on the group and work with the group, particular focus on research and data, mitigation being part of the remit, or at least not excluded from this group, a focus cross-government on particularly, I think, on co-benefits. So selling the benefits in terms of people's health of policies and actions, climate actions in other areas. The international agenda was mentioned, and the following speakers are going to be talking more to it. Even the WHO Europe network, I think, that Vladimir was talking about, plugging in very proactively and vibrantly into any international agendas. Other things could be mentioned: the integration of climate change into planning, into service planning, into obviously business continuity planning, into strategy a bit more. We have strategies that we're using in the health sector. They need to feature climate change a bit more. And I'm thinking of Sláintecare in particular, but there are other strategic initiatives underway. More work in terms of vulnerability and population vulnerability in that piece. So there's a whole lot. The Minister described it as the start of a conversation when Simon Harris was launching the plan, and I think that's a very true piece. I think this plan is a good opportunity in the health sector, to focus and to intensify and to accelerate work on health effects and climate change. And I'm sure that with the help of people in the room here, that's exactly what we intend to do and to achieve together. Thank you very much.